Hi, I'm Dr. Harry Wasbury. I'm the Chief of Colorectal Surgery at Beaumont. Today we're going to talk about methods and screening for preventing colon and rectal cancer. A colonoscopy is very important. It is a test that looks for small polyps. We know that about every third person out there will have a small polyp, and if you leave them there, they can grow to become big polyps, and then the big polyps can grow to become cancer. So the goal with the colonoscopy is get in there early, pluck those polyps out while they're small, and ideally by doing such, we eliminate or we even diminish the chance of getting colon cancer in the future. All people are vulnerable to getting colon rectal cancer, and so all people should be screened. Recently, there's been a trend noticed that patients at younger ages are getting colon and rectal cancer. The typical guidelines have been age 50 to 75. Recently, the American Cancer Society has lowered those guidelines to age 45. Slowly, the insurance companies are catching on to those guidelines, so ultimately, I believe the new screening age will be anywhere from 45 to 75 years of age. There are exceptions. If you have a family history, especially a strong family history, often you will go 10 years younger than that family member that had colon cancer. If you have other risk factors such as inflammatory bowel disease or any inherited patterns in your family, and certainly if there's any symptoms, low blood counts, bleeding, abdominal pain, change in bowel movements, then screening can often start at a younger age. People always fuss about the colonoscopy prep, and I've taken it myself. It is not that bad of an ordeal. What it is, it's a salt load. You have to take in a certain amount of salt with a lot of water to purge your system, and we like to do it within a 24-hour period. For that reason, people fear the colonoscopy, but the prep is not that bad. It's done over a 24-hour time frame, and most people tolerate it quite well. During the colonoscopy, you will be sound asleep. The medications, it's an instant nap. It takes about 20 to 30 minutes to do. We look through the entire colon with a flexible scope. If there are polyps there, we remove them at the time. And then once we finish, the medications are turned off and you will immediately wake up and for the most part go on with the rest of your day. So after the colonoscopy is done, the doctor comes out and talks to the patient after they wake up, and they wake up almost immediately and they're coherent and able to converse. We will give them the immediate results at that time, but sometimes there's a biopsy that's taken. That takes about 4 to 5 days, and then the doctor or the office calls the patient, lets them know that the results are good, and then tells them their follow-up time frame, which may be anywhere from 5 to 10 years. Waiting for symptoms is waiting too long. Please talk to your doctor today.